All right, let's dive right into the topic of gastroenteritis and explore its various causes. Gastroenteritis, commonly known as the stomach flu, is an inflammation of the stomach and intestines. It can be caused by a variety of factors, including viruses, bacteria, parasites, and contaminated food or water sources. First off, let's talk about viruses. Viral gastroenteritis is the most common cause of the stomach flu. Some well-known viruses that can cause gastroenteritis include rotavirus, norovirus, and adenovirus. These viruses spread easily from person to person, especially in close quarters like schools or nursing homes. Bacteria are another culprit behind gastroenteritis. Bacterial gastroenteritis can be caused by various bacteria, such as Salmonella, Shigella, Campylobacter, and E. coli. These bacteria usually enter the body through contaminated food or water, and it can also spread through contact with infected people or surfaces. Parasites, although less common, can also cause gastroenteritis. Some examples of parasites that can lead to stomach flu are Giardia, Cryptosporidium, and Entamoeba histolytica. Parasitic gastroenteritis typically occurs when you consume contaminated food or water, particularly in areas with poor sanitation. Lastly, contaminated food or water sources can be a significant cause of gastroenteritis. Consuming undercooked meat, raw eggs, unpasteurized milk, or contaminated produce can lead to foodborne gastroenteritis. Drinking contaminated water, such as from untreated wells or streams, can also result in illness. In summary, gastroenteritis can be caused by various factors, including viruses, bacteria, parasites, and contaminated food or water sources. It's essential to be aware of these causes to better understand how to prevent and treat this unsettling stomach flu. Now that we've explored the various causes of gastroenteritis, let's discuss the common symptoms that you might experience when dealing with the stomach flu. It's essential to recognize these symptoms so you can seek appropriate treatment and take necessary precautions to prevent the spread of the illness. One of the primary symptoms of gastroenteritis is diarrhea. Diarrhea can be watery and frequent, leading to dehydration if not properly managed. It's crucial to keep an eye on this symptom, as it can become severe and cause complications. Nausea is another common symptom associated with gastroenteritis. It's that unpleasant feeling in the stomach that often precedes vomiting. Speaking of vomiting, it's also a typical symptom of the stomach flu. While it can be uncomfortable and even painful, vomiting is your body's way of getting rid of the harmful pathogens causing the illness. Abdominal cramps are another telltale sign of gastroenteritis. These cramps can range from mild to severe and can make you feel extremely uncomfortable. They're caused by the inflammation in the stomach and intestines, which irritates the muscles and causes them to contract. Lastly, fever can accompany gastroenteritis, especially if it's caused by a bacterial or viral infection. A fever indicates that your body is fighting off the infection, but it's essential to monitor your temperature and seek medical attention if it becomes too high. In summary, the common symptoms of gastroenteritis include diarrhea, nausea, vomiting, abdominal cramps, and fever. Recognizing these symptoms is crucial for seeking appropriate treatment and taking necessary precautions to prevent the spread of the stomach flu. Now that we've covered the causes and symptoms of gastroenteritis, let's talk about the effective treatment options to help you recover from the stomach flu. Keep in mind that the treatment will vary depending on the severity of your symptoms and the underlying cause of gastroenteritis. One of the most critical aspects of treating gastroenteritis is oral rehydration therapy. This treatment involves consuming fluids with a specific balance of electrolytes and sugars to help replenish the fluids and nutrients lost due to diarrhea and vomiting. You can use over-the-counter rehydration solutions or even make your own at home using water, sugar, and salt. It's essential to stay hydrated, as dehydration can lead to complications. For those struggling with nausea and vomiting, antiemetic medications can be beneficial. These drugs help to reduce nausea and prevent vomiting, making it easier to keep fluids down and stay hydrated. Some antiemetic medications are available over the counter, while others may require a prescription from your healthcare provider. Maintaining a proper diet is also crucial when recovering from gastroenteritis. While your stomach may still be sensitive, it's essential to gradually reintroduce food into your system. Start with bland, easy-to-digest foods like bananas, rice, applesauce, and toast, commonly referred to as the brat diet. As you start feeling better, you can slowly reintroduce other foods back into your diet. In summary, the effective treatment options for gastroenteritis include oral rehydration therapy, antiemetic medications, and maintaining a proper diet. By following these treatments and closely monitoring your symptoms, you can recover from the stomach flu and get back on your feet. Remember, if your symptoms worsen or don't improve after a few days, it's essential to seek medical attention. Now that we've discussed the causes, symptoms, and treatments for gastroenteritis, let's focus on some preventative measures you can take to reduce your risk of contracting this stomach flu. By following these guidelines, you can protect yourself and others from the unpleasant experience of gastroenteritis. First and foremost, proper hand washing is crucial in preventing the spread of gastroenteritis. Make sure to wash your hands thoroughly with soap and water for at least 20 seconds, especially before preparing or eating food, after using the bathroom, and after touching surfaces in public places. Hand washing is one of the most effective ways to prevent the transmission of viruses, bacteria, and parasites that cause gastroenteritis. Next, practicing good food safety habits is essential to reduce the risk of gastroenteritis. This includes washing fruits and vegetables thoroughly, cooking meat and eggs to the proper temperature, and avoiding cross-contamination by using separate cutting boards for raw meat and other foods. Properly storing and refrigerating food can also help prevent bacterial growth and reduce the risk of foodborne illness. Vaccination is another preventive measure to consider for certain types of viruses that cause gastroenteritis. For example, a rotavirus vaccine is available for infants, and it's highly effective in preventing severe cases of rotavirus gastroenteritis. Staying up to date on vaccinations can help protect you and those around you from illness. In summary, by practicing proper hand washing, following good food safety habits, and staying up to date on vaccinations, you can significantly reduce your risk of gastroenteritis. These preventive measures not only protect you, but also help prevent the spread of the stomach flu to others. So, let's keep ourselves and our communities healthy by taking these simple precautions. Lastly, let's discuss the potential complications of gastroenteritis and when to seek medical attention for severe cases. While gastroenteritis can be an uncomfortable and unpleasant experience, it's important to be aware of the more serious complications that can arise if left untreated. Dehydration is one of the most common complications of gastroenteritis, especially when diarrhea and vomiting are severe and persistent. Dehydration can lead to a range of issues, such as dizziness, weakness, and even fainting. It's crucial to monitor your fluid intake and ensure you're staying hydrated with oral rehydration therapy or other suitable fluids. Electrolyte imbalances can also occur as a result of gastroenteritis, particularly when you're losing significant amounts of fluids through diarrhea and vomiting. Electrolytes such as sodium, potassium, and magnesium are essential for maintaining the proper functioning of your body's cells and organs. An imbalance in these minerals can lead to muscle cramps, irregular heartbeat, and even seizures in extreme cases. So, when should you seek medical attention for severe cases of gastroenteritis? Well, it's important to consult a healthcare professional if you experience any of the following: persistent diarrhea or vomiting that lasts more than a few days, Lastly, if you experience the investment based on date, it's essential to seek medical attention for severe cases, or if you experience any concerning symptoms. Timely intervention and appropriate treatment can help prevent these complications and ensure a faster recovery from the unsettling stomach flu.